Welcome, everyone. This afternoon, we're going to be talking about the rise of digital health enabling seamless business transformation. The healthcare industry has gone through a complete transformation in the last year as market forces and the impact of COVID has forced payers and providers to rapidly embrace digitalization. This power panel will discuss how leading healthcare firms are leveraging digital technologies and strategic partners to enable end-to-end business transformation across the value chain. This digital forum will also provide the latest insights on how healthcare firms are looking at business transformation and the evolution of healthcare in both the health plan and the member point of view, as well as the health system and provider point of view. So with that being said, we'll turn it over to our panelists and allow them to do some brief introductions. Wasif, you want to start?
Hi, Matt. Thank you. I'm Wasif Rasheed. I'm the EVP, Chief Revenue and Growth Officer at Providence Health. Providence is a provider system based primarily on the West Coast with facilities from Alaska all the way to Texas. My core responsibilities are running the revenue cycle function and our corporate development and diversification efforts.
Thanks, Wasif. Jayme?
Jayme Pu'u, Senior Vice President of Internal Operations for HMSA here in Hawaii. We're actually the Blue Cross Blue Shield of Hawaii. We serve a little over half of the population here in Medicare, Medicaid, as well as private business and self-insured. And my responsibilities here is to manage all of the back office and middle office functions for our health organization. So that's between claims and credentialing and customer service.
And Anita.
Good afternoon. Hi, Matt and team. My name is Anita Karlsson. I'm the managing partner at IBM for our BPO business for the Americas and have an opportunity to partner with a lot of clients, different sectors in how to drive digitization and business transformation into their operation. Great to be here.
Okay, great. All right, let's start it off. Let's start at the high level. Let's talk about goals. Though payers and providers have maybe had slightly different focuses and even somewhat different visions, it feels to me like the lines are starting to blur. And business transformation efforts have come to the point where many of those goals are starting to more closely align. So I want to test my theory on this a little bit. Jayme, maybe you could start off. Tell us about the top goals of your organization.
No, thanks, Matt. Yeah, I think at the fundamentals behind it, it's key for us to build critical partnerships and retain those with our health system and providers. One of our biggest opportunities here in Hawaii is to focus on how technology or how we can leverage technology to establish a better integrated delivery system. And as you know, as the Blues, we're normally a pretty open, free network PPO type of product. And, we pride ourselves here as being a little bit of a free choice, which is why consumers typically choose us. And but at the end of the day, in order to really focus on things like data integration, making sure that we're aligning our finances and are affordable, and embracing the consumer experience and focusing a little bit more on consumerism, it takes key partnerships with our local hospital health system partners.
So Wasif, talk to us about it from your point of view a little bit. What are your top goals?
Sure, thanks, Matt. The shifting of financial responsibility to patients is making it increasingly necessary for both providers and payers to review and simplify the patient's financial journey. Now, within revenue cycle, our top goal is to ease the administrative and financial burden for patients by focusing on improving the human touch point and incorporating technology where it can simplify or augment the experience. At Providence, we've been working hard trying to reduce the friction between payers and providers. And I think everyone would agree there's a lot of this is just dead weight loss that exists between both of our organizations. I think improving this will reduce a lot of the administrative burden that exists within healthcare.
So it seems like over the last 2 years, a lot has changed. Both payers and providers are embracing new technologies. They're looking at new ways to transform the delivery of care. And where payers and providers are looking to use technology and do things differently with that technology, what types of technology are we focused on? And Jayme, I'll ask you first a little bit from a payer standpoint, but what are the big things you're looking at from a tech standpoint? And then Wasif, I'd love to see if sort of those things align on the health system side as well.
Just commenting a little bit, answering your question directly, as well as maybe commenting on what Wasif had mentioned. I think he's absolutely correct around transparency and the ability to make things simpler for his patient and our members. I think at the end of the day, our success is really how we can coordinate care with our health systems. And I think a good example of that is sharing of information and data. We sit on a plethora of data, and it's really how do we use that and how do we share it and find the right partner. And I think going through that, a good example would be, should the health plans continue to provide a lot of that transparent technology data in their portals, or should we be comfortable partnering with our hospitals and health systems to share that information so that that information might be available in their portals? So I think a lot of it has to do with collaboration and integration. And we as a payer, a lot of times, I think we have to take a step back and say, are we going to invest in that technology, or are we going to partner to invest in technology that would allow to improve that consumer experience? And again, I feel like our opportunity is going to be around sharing that data, integrating that data, leveraging APIs, our ability to provide analytics and equip and empower our hospital health system providers.
Yeah, you think of it like an omni-channel strategy from a patient standpoint is they don't care. And most patients and the average typical member doesn't know the difference between where the lines draw between the health plan and the health system. So Wasif, just from your point of view, same kind of strategy on the data side, other things you're looking at?
Yeah, just to maybe add on to what both you and Jayme were saying earlier, our first phase of technology integration is focused on the patient experience across the front end and back end revenue cycle. That is the patient interactions during the registration process, the insurance verification, the cost estimation, and the process automation to transform the collections with a better patient experience at a lower cost. In addition, there's been an acceleration in the shift in how patients are engaging with care. As over the last several months, televisits have increased and health at home has increased dramatically. So we're also adapting our processes to ease access to our patients connecting into the health systems.
So curious, Anita, I'd love to bring you into this part of the conversation. You've got probably an interesting view from a service provider standpoint. You see a little bit of everything. What are the common threads? What are the unique technologies that you're seeing?
I see the common threads that we see as we partner both with providers and payers in this space is three things around outcomes. One is, if you mentioned already, a lot of focus around experience, not just the patient, but the employees, the medical staff, the nurses, etc., everybody in the ecosystem, that they have the best experience possible. Number two is around, of course, the financials. To drive a lower cost, more efficient operation continue to be very important in any of all transformation projects. And then third, maybe even more so after COVID, or still in COVID, but the experience we've had the last year, is to create a more resilient operation, like to manage the risk even better and even stronger. So those are three common threads we see specifically in this part of the industry. And I personally love the point, and Jayme, you mentioned it as well, the focus on how do we have a better experience for the patient, for the member throughout this.
When I start putting myself in the shoes, and I actually think I have a little bit of a different experience for myself versus my mom. Right, myself, when I'm logging on to my member plan, I don't care who my provider is. I'll go through my health plan to find a doctor, to find a provider. My mom will go immediately to the hospital system that she knows that she's comfortable with and look to find out if her health plan covers it. It's sort of two different avenues to the exact same path. So just thinking of that patient journey, what matters the most to patients, to members along the way? Is it transparency? What are the big things? And maybe Jayme, will start with you, But then Vasif, I think you'll have another very interesting point of view on what matters to the individuals, the people we see as our patients or our members here.
No, that's a good point, Matt. I think everyone is on a different journey in their life, right? Some are, maybe moms and babies at a younger age, encountering the health systems in a different way. Others have chronic conditions or, an emergency need. But when we look at it across the spectrum, we've done a lot of sort of surveying and data to understand that at every point in someone's life, their experience is very different. And you can't create a one size fits all on what consumers really want. And I think for us, the biggest piece was to make sure that we embrace that both our member and the provider's patient is one of the same. And how do you create an experience around that? And what can the health plan bring to the table? And I think part of some of our strategy has been to look around, what's important to them. And I think cost is very important. What are they paying out of pocket? Do they even understand their plan? Is there a surprise at the end? And so we've pride ourselves in really looking at product simplification opportunities. As an 80-year-old health plan here in Hawaii, you can imagine we've had hundreds and hundreds of different products that we offered. And to the consumer, they're just confused. So we spent a lot of time thinking about both digitally and, sort of from how we can enable this, making it as simple as possible and clear how they can access their care through our systems, through our providers, and what they can expect on their out-of-pocket. Specifically in Hawaii, interesting enough, different than most other parts of the country, we still have a large portion of individual providers, 1 to 2 small private groups of physicians working on disparate systems, not necessarily integrating their electronic medical records. We spent a lot of investment in time offering tools and products that would integrate their systems across, so that if they went to an individual cardiologist in the community and then also accessed one of our local hospital health systems, how do we make sure that we're sharing that information? So
that continuity. The continuity of the experience.
Exactly. So the example that you gave with your mom or yourself, how do we make sure that no matter how you accessed our network within our state, that information is being shared and you can see, hey, Matt just picked up this medication not too long ago, and now I'm fully equipped with a bigger 360 picture.
Wasif, I'd love to hear your point of view on this. Is it the same types of friction opportunities? Is it cost surprises? Is it pricing transparency? Are there other things that really smooth out those friction points from your point of view?
Yep. First of all, Matt, I really appreciated how you sort of framed this question up front of thinking about how our moms or even our loved ones sort of interact, with our health system. And, first of all, I'll say first and foremost, patients are vulnerable in the care setting, right? Their primary focus is on their health, and the administrative side of payers and health systems is a total mystery to them. So think of all the ways a retail experience for a consumer on Amazon, for example, is different than a patient experience in a healthcare system. And it's clear that we have a long, long way to go. Transparency, cost, payment options, and a simple and streamlined experience will allow consumers of healthcare to make the best care decisions for themselves and their families.
It seems like the openness of the data and the very conscious sort of life cycle effort of those members and patients and that's going to have to go through a very careful design process that will have to remove some of those ongoing sort of points of friction that we've seen. I want to shift the topics a little bit, stay on the provider side if we can, Vasif, with the enormous investments in telehealth, in digital therapeutics, all of these things, right, that are sort of upending the typical business models, or at least the possibilities of the way we deliver care, thinking about how do referrals work and follow-ups and all of those kind of things. Has there been a dramatic change in the way that we look at care from a provider standpoint?
Sure. The question to me is understanding how sort of digital transformation is going to impact healthcare delivery model. There's no doubt that it has, but how it evolves is going to be critical. To the extent of which these innovations persist and how they are going to be used is going to inform the business model and support the patients that we really want. This new paradigm is fundamentally about a shift to a more patient-centric healthcare delivery model. Our business apparatus should support that and not define it. What is interesting is that the way that care occurs may dramatically change. For instance, could there be a brief daily check-in with higher risk patients? How does the reimbursement model sort of reflect that? Could consultants be brought into the discussion between a patient and a primary care physician to address specific questions as they come up versus the existing paradigm of being referred to a specialist and then coming back down? These changes will force the business model to change.
Jayme, have we started to rethink about how the health plans and the benefit structures change how consumers potentially view the possibilities, how they potentially consume the benefits up front, or is it too soon to assume some big changes in the health benefit structures and the plans?
I think it's the right time. I feel like COVID probably helped us to leapfrog in a couple of areas. HMSA was actually one to bring telehealth and a best-in-class technology here in our market at a time where it wasn't being embraced by consumers. And actually, between pre and post-COVID, we've seen an exponential increase in use, 3,000% increase over the last year, which is amazing. For us as a plan who brought the technology over 10 years ago, thinking that in an island-based state, geography and access being such a challenge, that telehealth would have, sort of skyrocketed back then, and it is now. And so, we've had to rethink our products, establish product designs for what the consumers really want and use our experience. 3,000% increase isn't, sort of small pennies here. There's an opportunity, I think, to really think through about what our product design could look like and incentivize the right behaviors, whether it's zero copays, for telehealth, or, embracing the PCP and member relationships and incentivizing those arrangements to allow for more telehealth. We also looked at things, and I think Wasif mentioned this too, is, that specialty, a little bit of that maybe old school, refer you to the specialist, and the specialist kind of, we've started to look at things like using telehealth for curbside consults with specialists, embracing kind of the care approach and the care team approach using telehealth. I would say we're still pretty early in looking at the technology around care teams, but it is the direction that we want to head, as well as kind of looking at the benefit and product design that would incentivize those behaviors.
Anita, it seems like whenever hospitals and payers have swift technology changes upwards of 3,000%, I think Jayme just said, they look to service providers, companies like IBM who provide some of this stuff. So what were the changes you saw? Was it a swift uptick? How did you adapt your business model to help become sort of the solution in this point of distress? Can you kind of give us a little bit of your point of view on how that went?
Yeah, for sure. The COVID in the past year has increased the speed at which companies and organizations are looking to drive transformation, and we have seen that. I think another important point is everybody's on a different journey, right? Every company is in a different journey, and it is a journey to drive this type of transformation. And for sure, leveraging exponential technologies is a key part where someone like IBM would love to come in and partner with companies to go make it happen. To Wasif, for you to be able to have those, a proactive maybe call to an individual every day, you got to free up that capacity from what they do today. And there are lots, as we've spoken about, a lot of inefficiencies in the core processes, in the revenue cycle management, insurance verification, etc., that can really do a redo or improvement in that process. And I mentioned earlier the second component around driving human or user-centric focus and empathy-driven experiences to help drive that transformation, which I think today is much higher on the list than what we saw just a year ago around focus. And third is a co-creation of this journey of transformation. We use at IBM the garage model to really get people in from all aspects of the organization and looking at the process end to end. Many you've heard it before, you might say it yourself. It's no point of automating an imperfect process, right? You got to improve the process, the basis of the process for them to apply technologies and automation to that. So we have seen some great examples in the past few years around how it's really driving meaningful improvements in the efficiencies, in cost reductions to create that space to operate that I think both payees and providers are looking for. Just mention a couple of data points, like Anthem have deployed a virtual chatbot in the call centers. They take about 46 million calls a year. They have now been able to deflect 5 million of them into chatbots and virtual agents. And in 3 years, they expect that to be 90% are going to go through the chatbot and virtual agents. And they also see an improved customer satisfaction because the answers the chatbot can give, many of the things that are coming into the calls are just questions. So they're getting a better answer, and the team on Anthem, they no longer just pick up the phone and answer basic questions. They now can spend more time to really add value to their people. And another area, and Wasif, there's a place where we're partnering today around recruiting, again, using platforms and automation just to improve and shorten the time to fill critical resources, because this market is brutal across the board, much as we know in the medical field, and to have a better, more targeted platform and technology around finding the right person for the right job is helping tremendously as well for companies. So that are some of the areas where we're partnering with payees and providers to create that space to operate that they're looking for.
So Wasif, I think this means a lot of investments, or at least at the very least, reallocation of capital to certain things, right? There has to be a pretty focused effort, and you don't want to bite too soon in two areas, but you don't want to be left behind. What are the big investments? I mean, if you're looking at, really the big game changers, what are those things that you're focused in on right now?
Sure, and I'll talk about it from maybe sort of two dimensions, both people and technology. On the people front, investing in our caregivers is a major priority. First, we're just emerging from a very traumatic experience over the last year. Ensuring that our caregivers have what they need to heal and to thrive is paramount. Beyond that, our evolving healthcare landscape requires capabilities in leadership, technology, process management, and passion for our mission more than ever. We want to help our caregivers gain the full benefits of streamlined workflows by helping them learn more intuitive processes and build new skills that we're working to build these muscles internally and partner effectively when necessary. Our hope and intention is that as caregivers experience less burdensome processes, they can spend more time on the human interaction that's at the center of patient care. On the technology front, we're excited across a number of different technologies. First, AI ML is an area that we are anticipating growing in the next 2 to 3 years. We're actively working to further our capabilities here. In addition, automating tasks is important, and we're looking for opportunities to continue this. Using natural language processing, OCR, and blockchain are also areas that we're excited and looking to push the art of the possible. Building additional capabilities in our electronic record partners and simplifying how patient engages throughout this entire sort of patient journey across the continuum of technology solutions is an important part of how we make all this possible.
Love that. Great answer. Jayme, tell us about what you guys are thinking about and where your big investments are going.
Yeah, thanks, Matt. On a people side, a little bit maybe like similar to Wasif, but more for our employees. COVID has changed how we're providing the services now. We went from almost 99% in person to close to 80% at home. And so we've had to spend a lot of time investing in different capabilities and supporting our workforce. It looks very different than it did before, to equip them and arm them to feel successful working from home. And, I'm sure other health plans have had this going on before COVID. In Hawaii, we're so relational. It's so critical that you show up every day and you can, talk to your coworker or your friend, and it sort of dispersed them across the state. And we've had to kind of create, and this sounds probably a little simple and maybe unimportant when you sort of say it out loud, but so important to our employees, that we needed to create an environment that they could still stay connected. Just again, embracing that aloha spirit, being extremely relational to sort of put the member at the center of their work. It was building connections. How do you do that when you're all disparate and working from home? So we've invested a lot of time thinking about how to keep our employees still very engaged. Communication was critical, leveraging, virtual technologies and the ability to still stay connected to themselves as well as what's happening in our community. I think on the technology side, we're on a multi-year roadmap around data and analytics. I think I spoke a little bit about where we're at on sitting on a thousands and, or I'd say millions probably, of just data and history. How do we use that, and how do we make it meaningful? And so I would say we're probably on year 3 of a multi-year journey of thinking about how we digest it, how we use it, how do we sort of forecast what our data tells us and make it intuitive for both provider, consumer, and even our government partners, our local community and partners want to know and be informed by big data, and so I think we feel a responsibility to ingest it, bring in other data sources, and understand what that information is telling us and how can it help broadly, not just specifically HMSA. But those are probably the 2 biggest things that we've been focusing on pretty urgently in the last year or 2.
Yeah, it really shifts the focus on the payer side. I think especially with this ultra focus on meaningful use of data from the administrative side of the activity to the health side of the patients, and how do you use it, expose it, be responsible with it in the most meaningful way to provide the best possible outcomes, to make the best patient experience. I think all of those things seem to be common themes we're hearing from payers. So that's great to hear. Anita, if you don't mind, just talk a little bit about it from the service provider standpoint. You guys are the path to a lot of the realization of these technologies. What are the big investments? Where is the interest peaking? Is it similar to the areas that Jayme and Wasif outlined? Are those the areas of investment that IBM is focused on, or are there others?
No, most definitely. And especially like Jayme talked about the data and analytics. There's so much data and insights hidden in each organization that we see every organization are looking for. How can I unleash that data to provide insights and help me, not just with what I do today, but also that looking ahead. What can I learn from my data to know what do I need to do now to be better prepared for the future? So for sure, around data and analytics, lots of investments, a lot of interest. I'd say the other area, maybe a little softer, but I think it's critically important around change management and process innovation and driving that change and create them, I say, a ongoing continuous improvement part of your organization. So it's not like you bring in a partner, let's go do this for 3 months and then we're done. No, it is an ongoing journey. And we, in our organization, our company, we got to drive that change. We got to be change agents throughout. And that requires different type of leadership, different type of work, like more agile operation, for example. And we certainly see clients investing a lot in that. And also, it might sound old now, but like the lean, the 6 Sigma, the lean way of working to really drive the most efficiency. Because like I said earlier, how we can help to free up the space for both the payer and the providers to be able to focus the time where it matters for the patient, for the member, for the society at whole. And the technology can do a lot. Mention machine learning, mention natural language processing. All of that is available, and it's getting more and more mature by the week, by the month. And we can do things now that we couldn't we were thinking about a year ago, it's now possible to do. So I guess the answer, Matt, is it's all of the above. But the key component is probably partner with someone to help figure out what is the right journey for me, right? What should I do first, second, third, based on where I am and the objectives I have, and always keeping that human empathy at the center stage.
Okay, great. All right, last question. I'm in California, so I look around, and even in California, I think in the next couple of weeks, we will be able to remove masks. We will be, I think, probably past the 50% full vaccination mark. We're starting to see a little bit of normalization in other states, even further along. Are we going to go back to normal from a health standpoint here? Is there a go back to normal, or do we think the patients and the members' behaviors are sort of permanently sealed and that they approach their health benefits differently? So just start, Wasif, if you don't mind, we'll start with you. Are we going back to normal, or are we going back to a different place? Just curious what your points of view are on this.
Matt, I think there is going to be a component of this that has sort of structurally changed our health system sort of going forward. I think over the last 12 to 16 months, we've built muscles, we've done things that hopefully will continue to stick. I think I talked a little bit about how patients and providers are getting more and more comfortable with televisits and beginning to realize value and the convenience. Work around care at home will not only extend both the reach of healthcare, but provide better access to individuals who found it burdensome coming into a health system. So I'm hoping there's some components of this that has built some memory muscle. But there's also been sort of structural changes in humans that have occurred over the last 6 million years, where face-to-face interaction is considerably different than having a Zoom meeting like this. So I suspect we'll be somewhere in between and continue to make progress around the digital transformation.
Great. Jayme, what do you think?
Matt, I think there's a not go back to normal, but there's a new normal. We're going to have to redefine maybe what that new normal is going to be. And I think in particular, one thing we sort of grappled around was, a good example is we saw a 40% decrease in emergency room visits. And that continues to sustain. And we actually believed right through our data that was going to rubber band back, right? We thought, wow, that's sort of interesting that it's still there. Mm-hmm. Where we're having a little bit of conundrum, is that a good thing or not a good thing, right? So are people still getting care, or are they avoiding care because of fear when they really appropriately should be seeing, a hospital emergency room, urgent care, whatever you want to call it. And so we're watching it really closely and trying to understand, right, that hopefully COVID is opening up doors of different kinds of access to care, again, televisits, home cares, Wasif mentioned, but making sure that people are actually getting the care that they need. So we're just spending a lot of time evaluating our data, understanding what it means, even thinking through on a practical setting, what's happening. And so far, we think people are getting the right care that they need. It's just being performed in a different way. And so, I think we're going to continue to embrace maybe what the new normal is. And as a health plan, as a payer, making sure that we're aligning incentives, creating the right products and benefit alignment so that we can continue to support what consumers may be creating as the new normal on how they're going to access care.
Yeah, it sounds like the people's behavior has changed. There's probably nothing we can do to change that, but we can adapt our plans, our services to allow consumers to better take advantage of those changes, to better take advantage of that technology. So I tend to agree with everyone's sentiments here. Well, I think we're coming close to the end of our webinar today. And I first just want to thank everyone for participating. I think this was very, very meaningful, very great discussion. Love to hear the direction that everyone's taking. Look forward to doing this with all of you another time if we can. So thanks everyone for your time, and we'll call an end to this today.
Thank you.
Appreciate all our viewers as well.
Thank you.
Thank
Thank-
you.